My name is Piasecki. I'm one of our sports specialists here in our sports medicine center. I loved sports medicine because I really wanted to fix things. And I thought more so than maybe in other areas of orthopedics, you really could fix problems among the sports problems. And I also really like the patients. The patients that I tend to see are not necessarily all professional or high-level athletes, but they're patients who want to stay active. And doing a number of different types of treatments, whether it's physical therapy or anti-inflammatories, injections or surgery, to try to get them back to the level of activity that they were in before is very satisfying.
Dr. Piasecki is one of the best at what he does. He thrives to do the best job he can. He's a perfectionist, so he's going to get it right. And he's very caring, he's very thorough, and he explains everything to the patient the way they can understand it.
I absolutely love working for my physicians. They're so kind and so giving, and they really, really care about their patients. And you can see that because the patient feedback that we receive, that we pay a lot of attention to, shows that.
I think personally the most important thing in taking care of patients is to do just that, to care about the patient. And I try very hard with all my patients to treat them as if they were a member of my family.
Dr. Piasecki is a phenomenal guy. He walks into a room, and when he walks in, he knows details about the patients. He remembers them. He truly has a relationship with his patients. He considers them like family, and he's going to do what's best for them.
Anybody who sits down in my office, I try to see in them my mom or my dad or my brother, my wife or my kids. And I try to explain to them what the options are, just as I would a member of my family.
I think we're a lot like family. We talk over problems. We come together to try to solve them.
I went skiing with my brother for his birthday, and it didn't turn out to be such a fun day.
Corey's a spectacular patient. She's one of my favorite patients. Very active woman who tore her ACL, essentially, with a twisting injury to her knee.
I went in, I know my first appointment with Dr. Piasecki, I had a list of things on my phone, and I thought, oh, I'm going to pull this out and he's going to cringe. And he said, no, let's just sit down, let's go over all of them.
We had a long discussion about what surgery to do and how to do it. She's very educated, very articulate, had a lot of very great questions for me, and after the surgery has done very well.
He was really able to put me at ease with, what the objectives were. What are your goals? What did you do before? What do you want to get back to? So I knew that when I met with him, that was probably just a great fit. It was the way I wanted to recover, the way he wanted to do the surgery fit together very well, and it actually worked out great.